each and every day. And now they've dusted one off from the state of New York. We haven't heard from her literally in years. And I mean, it's all falling on deaf ears because while they change their message every week, the only thing consistent is that they lie. As Democrats, we remain consistent in our policy position. Let's reopen the government. Let's enact a bipartisan spending agreement. Let's lower the high cost of living. Let's address decisively the healthcare crisis that Republicans are malignantly visiting on the American people.
Leader Hakeem yesterday indicated there's been an uptick in bipartisan rank and file negotiations for ending the shutdown. Are you getting briefed or read in on those talks? What are you hearing from your colleagues?
It's not clear to me that John Thune is being accurate when he reports that there's an uptick in bipartisan communication. What communications is he talking about? I think there's informal conversation taking place among some senators on the Republican side who apparently recognize the need to address the affordable health care crisis that Republicans have created in the same way that Marjorie Taylor Greene has been very clear on the House side that there is a healthcare crisis, that we need to address the affordability issue, that we should extend the Affordable Care Act tax credits, and that we actually need some leadership coming from Republicans in the House who've been missing in action and on vacation for 5 consecutive weeks. They're going to get paid. Some of them have been camping and then publicly bragging about it. Others apparently have been in Russia. And yet, hardworking federal employees are being asked to work without pay or being furloughed and don't know how they're going to put food on the table. And the best we can get from John Thune is that he believes there's been an uptick in conversations. These people have been missing in action over the last 30 days. It's so irresponsible that Republicans continue to insist that Democrats participate in their toxic effort to gut the health care of the American people. We're not going to do it.
Thank you, Mr. Leader. President Trump posted on True Social late last night that he wants to resume nuclear testing and is reportedly told the Pentagon to immediately resume U.S. nuclear weapons testing. I was wondering if I can get your reaction to that and what that means for some of our adversaries like Russia and China.
Yeah, it appears that the resumption of nuclear testing would be a massive breach of international treaties that have been in place for decades. And it's just another example of Donald Trump and Republican policies going too far, being divorced from reality, and that Donald Trump and Republicans are not focused on the main thing that the American people want us in the Congress to address, which is why, as Democrats, we're going to continue to relentlessly focus on driving down the high cost of living in this country and fixing the healthcare system that Republicans have broken.
Yesterday and today, Senate Democrats, particularly Senator Warner, have been upset about the GOP only Senate briefing about the strikes in the Caribbean. You, as a member of the Gang of Eight, have you had any briefing or had any talks with Intel officials about it?
No Intel talk has taken place, even amongst the Gang of Eight. And certainly no information has been presented from the Trump administration or the Intel community that provides any basis for the strikes that we've seen, anchored in the law or the Constitution, off the coast of South America.
Do you believe there needs to be a briefing of the Gang of Eight?
Yes.
I wanted to ask, when was the last time you did speak to Delegate Eleanor Holmes Norton? And considering the recent police report that indicated she had dementia and needed a caretaker with power of attorney, do you think she should run for re-election?
Yeah, I'm unaware of that particular report, and I haven't had a conversation with Delegate Holmes Norton in a few weeks. Thank you, everyone.
Thank
Thank
you.
you.